The Medicare program is incredibly confusing to most Americans. If you or a loved one are currently enrolled in the Medicare program or will be aging in the near future, chances are you may not really understand what this crazy program is all about. Well, that's why Medicare Made Easy exists. Too often our clients come to us with basic Medicare questions when they've been in the program for years. Of course, this is perfectly understandable, as the only reason we professionals really have a grasp on it is because we are required to do training and the education every single year. We aren't special, we're just compliant. With any Medicare discussion, the first thing we need to hit would be what we call Original Medicare. Original Medicare is essentially your home base of the program. This section of senior health insurance sets the precedent for what other health plans do and do not cover. Original Medicare has two parts. The first is Part A, which covers all inpatient care. If you or your spouse have been in the workforce long enough to meet the government's required FICA contribution amount, which is almost everyone, you don't have to pay a monthly premium for Part A. Part A has a benefit period deductible of $1,364. This covers you for the first 60 days of an inpatient hospital or skilled nursing facility stay. Not bad, right? With my insurance, I get charged that within the first 60 seconds. If you need to stay longer than 60 days in a benefit period, your copay is $341 per day. Medicare technically covers up to 90 days per benefit period, but what if you need to stay there past 90 days? Well, don't worry. Medicare offers a set amount of 59 lifetime reserve days that can be borrowed from at a copay of $682 a day. These days do not renew every benefit period. Once one of these days has been used, then it is subtracted from the number of available lifetime reserve days. Now let's move on to Part B. Part B is the other hand of Original Medicare. Part B covers all your outpatient services, things like doctor's office, visits, diagnostic imaging, outpatient surgery, and the like. Unlike Part A, Part B of Original Medicare does in fact have a monthly premium, and the Part B deductible is $185 a year. So, when you go to receive outpatient services at the beginning of the year, you pay the first $185. After that, you pay 20% of all Part B charges. Now, unfortunately, with Part B, there is no safety net or maximum out-of-pocket. This means it doesn't matter how high your outpatient bills get to be, you still have to pay 20% while Medicare pays the other 80%. So that's Original Medicare. Now let's move on to what we call New Medicare. This isn't an official industry term, but we think it's a useful way to visualize the rest of the program. New Medicare is administered through private insurance companies with funding from the Centers for Medicare Services. Part C, or Medicare Advantage, is the first part of what we are calling New Medicare. Medicare Advantage replaces Original Medicare. Private health insurance companies administer these plans with funding from Medicare. These plans have either no premium or very little premium. They do include doctors' networks, just like any other HMO, PPO, or private fee-for-service plan. They are required to cover everything Original Medicare covers, but they do so typically at smaller cost sharing. Each plan also includes extra benefits that vary company to company. These benefits are things that Original Medicare does not cover. One of the main benefits to Medicare Advantage plans is that they include a maximum out-of-pocket. This means that there is a finite amount of money that you can take from your own pocket each year to pay for medical expenses. Again, this is something Original Medicare does not offer. With Medicare Advantage, there are two different types of plans offered. The first type is the MA only. These only replace services for Parts A and B of Original Medicare and are designed for those who have other drug coverage, such as the VA, TRICARE, or an employer or union retirement plan. The vast majority of Part C enrollees pick the MAPDs, or Medicare Advantage with prescription drug coverage, which not only cover the Original Medicare services, but also include coverage for prescription drugs, also known as Part D. So that's a good transition into the second part of New Medicare, which is Part D, or prescription drug coverage. Just like Part C, Part D is administered by private companies and is funded in part by Medicare. For 2019, the average premium for Part D was $33.19. Each Part D plan has a list of drugs they cover called a formulary, and formularies vary from company to company. There are several different levels of out-of-pockets Medicare beneficiaries can reach throughout a plan year, and they are all based on the full costs of medications. Starting off at the beginning of the plan year, beneficiaries are typically in the deductible phase. The deductible varies from plan to plan, however, Medicare has said that no plans may have a higher deductible than $415. The deductible applies only to the higher-priced and name-brand medications. So once the deductible is met, the next stage is the initial coverage phase. The initial coverage phase gives members copays and coinsurances based on a tiered system. Lower priced generics are on lower tiers and higher priced drugs are on higher tiers. The copays and coinsurance at this stage also differ plan to plan. Members stay in this phase until the total costs of their medications get to be $3,820. At this point, they go into what's called the coverage gap, or donut hole as it is sometimes referred to. In the coverage gap, members pay 33% for generic drugs and 25% for name brand. This stage ends when the total cost of the medications reach $5,100, at which time members enter the catastrophic coverage stage, where they remain until the end of the year. In this final stage, members pay 5% or less for their medications. On January 1st, the drug coverage resets and the beneficiaries begin once again in the deductible stage. It's important to understand that not everybody will go through these phases of drug coverage. Since members only advance to the next stage when their medication costs get to a certain dollar amount, many individuals may stay in the initial coverage phase for the entire year as their medications are inexpensive. And this concludes our discussion of the Medicare program. This is only a basic overview, so please feel free to consult Medicare.gov or a local broker for information on coverage in your area. Thanks so much for watching. Bye-bye.